had no idea what to expect after the delivery of my baby. At first, everything was fine. In fact, it was great. I brought the baby home, and my entire family was so excited to drop by and finally meet her. I wanted everything to be perfect, but I didn't realize how hard it would be to manage my marriage, family, new baby, and household chores on top of that. I was educated a lot. I was encouraged to breastfeed for my baby's health. But I had no idea how much time this took up every day. My entire schedule revolved around the baby. And I loved her, but it revolved around when she wanted to eat, when she wanted to sleep. I had no time for myself. I began to get so exhausted, I could barely get out of bed in the morning. I cried all the time. My husband started telling me that I needed to take care of myself. I had to find some time. I needed to do it for myself and for the baby. I felt so guilty that I was unable to take care of my own child. I felt like the worst mother.
I was so excited for the arrival of my baby. My husband and I had already decorated the whole room. We weren't going to find out if it was a boy or a girl, but we just couldn't wait to get everything together. We had to know. When we found out it was a boy, we were thrilled. We immediately started picking out clothes for our new baby boy. And now we have a closet full of clothes and no baby to wear them. I was strong for a while, but then I slowly started to lose myself. I felt guilty. My body wasn't strong enough to deliver a healthy baby. I felt inadequate as a woman and as a mother. At first, I wasn't able to get out of bed, and I cried until I couldn't possibly cry anymore. I didn't eat for days. I mean, what was I supposed to do? Someone told me to just move on, and that I could always have another baby. But I don't want another baby. I just want mine back. It got to the point where I just didn't feel anything anymore. And sometimes I wonder why I'm even here.
When I found out I was pregnant, I had no idea what I was going to do. I already had 3 kids. Now I have to do everything on my own because my boyfriend left once he found out I was pregnant. Cooking, cleaning, and taking care of the kids are a full-time commitment. On top of that, I have to work 40 hours a week. Even though I have all these responsibilities, I decided I wanted this baby. But once I brought him home, I realized it was way harder than I could have ever imagined. Compared to the first 3, this was by far the hardest time I've ever had caring for a new baby. I felt so overwhelmed. I never got a break. There was always something that needed to be done. I couldn't sleep. I felt sad and hopeless. I found myself losing my temper around the baby because it just wouldn't stop crying. I felt so guilty, but I couldn't help it. I just didn't know what to do anymore.
The stories of these 3 women happen more often than you think. 1 in 8 women suffer from postpartum depression. It can occur any time during the first postpartum year, but it usually starts around the 4th week after delivery. Some risk factors can predispose the woman to postpartum depression, such as first-time parenting, lack of social or family support, postpartum blues, history of depression or bipolar disease, body image and eating disorders, poverty, depression during pregnancy, and loss of a newborn. Symptoms include sadness, frequent crying, insomnia, appetite changes, feelings of worthlessness, obsessive thoughts of inadequacy, disregard of their appearance, and irritability or hostility towards their infant. Now, this is not to be confused with postpartum blues, which occurs during the first few days after delivery and it lasts less than 2 weeks. The symptoms of postpartum blues include excessive crying, but not knowing why. If your symptoms last longer than 1 to 14 days after delivery, you may be suffering from postpartum depression and you need to seek help immediately. It is important to have support. Find someone to talk to about your feelings. You can find someone to help you with your household chores and errands. By doing this, all the stress is not on you. It is important to take time for yourself. Even just 15 minutes a day of an activity that you enjoy can be a nice break. Medications are also available if these interventions are not successful. SSRIs, or selective serotonin reuptake inhibitors, can be prescribed, which include Prozac, Zoloft, and Paxil. These are the first choice because only small amounts of this medication are excreted in the breast milk. Most of the times, these women don't even realize that they have these symptoms. It takes the people around them to notice the change and speak up. Listen to those around you. Seeking help does not make you helpless. You do not have to live with these feelings.
I talked to my doctor who recommended counseling treatment. The counselor helped me to realize that how I feel is okay. Now I can set realistic goals, and I don't have to do everything myself. It's okay to ask for help. I've also been encouraged to ask for assistance on everyday tasks like cleaning, cooking. My husband now does the dishes for me every night. I don't feel as overwhelmed anymore.
I was able to seek help after the death of my baby. The doctor prescribed antidepressants as well as therapy for my husband and I. The antidepressants helped me to get out of bed in the morning. The therapy helps us discuss our feelings about the loss of our baby. It will take time to heal, but we're making progress. I never thought medications would be necessary for me, but I've come to realize that it doesn't show weakness. These medications help me feel like myself again.
When I talked to my doctor, she recommended a support group. It was really helpful to talk to other women who were experiencing the same thing I was. In the group, we talk about our stories. We're able to give each other advice in and out of the group. I have people to call when I need it, or when I just need to talk. It's nice to feel that I'm not in this alone.
Talk to your doctor to see what is best for you, or call the number below for immediate help.
It's not your fault.
There is help. There is hope.
Well, I ain't seen the sunshine since I left my lover. Now I can't